Our topic of discussion for today is endometriosis. Endometriosis is a term that is derived from endometrium. Endometrium is, as you have studied the anatomy of your reproductive system, endometrium is the lining inside your uterus that bleeds every month with your menstrual cycle. So, endometriosis hota kya hai? It is basically a pathology in which this endometrium tissue or this lining of uterus is formed elsewhere in the body. मतलब कि यूट्रस के अंदर तो प्रेजेंट होगी मंथली ब्लीड करेगी but if it is present elsewhere in the body, for example on your ovaries, on your fallopian tube, on the head of your uterus, anywhere in the body, in the peritoneum, in the pelvic region, anywhere if it is formed, then it is known as endometriosis, right? What we are going to do is we are going to discuss its pathogenesis, that how is it formed, its symptoms, that the symptoms it gives after being formed. We will discuss its outcomes, how its outcomes basically causes the symptoms, and the diagnosis, the treatment. We are going to discuss everything. So let's begin. When this lining of the uterus is formed on your ovary, fallopian tube, head of the uterus, your peritoneum, anywhere, the supporting structures anywhere, so it obviously leads to some impacts because it's not on its original place. What are the impacts? जो impacts होंगे, they are basically the things that are causing the symptoms, right? So what happens is that this endometrium lining, when it is formed here, or here, what it does is that according to your normal cycle, what happens that your ovary secretes hormones. These hormones basically thicken your endometrium, and if the fertilization does not occur, if the fertilization occurs, if the sperm enters and it fertilizes the eggs, then the embryo forms and everything happens. If the fertilization does not occur, pregnancy occurs if fertilization occurs, right? But if fertilization does not occur, then what happens? Then your menstrual blood comes out, right? Bleeding occurs. So what happens in this endometriosis? What happens is that these tissue, they respond exactly the same way the uterus endometrium will respond to the hormones. So what happens is that when the ovary releases hormones, it thickens the endometrium. This endometrium will also thicken. It will also release blood, but where comes the difference is that here the blood has a space to go out, right? The blood will come out of here and it bleeds. But what happens here is there is no place to go out. Here is from where the problem starts. When the blood has no place to come out, it will irritate the surrounding structures. It will cause inflammation, which leads to pain. So the first symptom is chronic central pelvic pain, painful periods or pain during intercourse, painful urination, abnormal bleeding, diarrhea, infertility, bowel movement issues. These all are arising because of this pathology going on behind it, right? What happens? The endometrium bleeds, this gets thickened. No place to go out. It pushes the structures which are on the other sides, and it will lead to pelvic pain. Okay, so this is basically whatever is going on. Now, what are the outcomes of it? As this endometriosis occurs, what it does is, first, inflammation, pain, that is understood. Second thing is that it forms the scar tissue, the fibrous tissue, that is known as adhesions. Adhesions can be formed. What happens due to the adhesions? Adhesion can lead to the pressure on the structure and, for example, on the fallopian tube. And adhesion is basically a scar tissue or a fibrous tissue which attaches different peritoneum structures to the fallopian tube or wherever it is formed. What it does is that it provides pressure, because of which, for example, the fallopian tube narrows. When it narrows, what is the result of it? That the egg will not come out, it will not get fertilized by the sperm, and infertility, right? So infertility is also one of the symptoms of endometriosis. Now, what are the sites where this endometrium tissue can be formed? Yeah, endometriosis can occur. First of all, on the ovaries. On the ovaries, when this endometrium tissue is formed or endometriosis occurs, it basically looks like a cyst on the ovary. What happens is that the endometrium, when the fertilization does not occur and the endometrium bleeds, the blood is accumulated inside it, and when the blood accumulates and it does not flows out, it basically appears in a chocolatey color. That's why it is on the ovaries. The endometriosis on the ovaries is known as chocolate cyst, which is basically a fluid-filled sac on the ovary. Chocolate cyst. It affects the fertility. Why? Because it is obviously applying pressure and does not allow the ovary to ovulate, to give away, to produce its egg. Fine. Then on the fallopian tubes, okay, or outside the uterus, as I have showed you, on the supporting structures around the uterus, on the peritoneum. These are basically the areas where the endometriosis can occur. Basically, it always occurs within the pelvis area, and therefore it leads to chronic pelvic central pain. If a patient comes to you with chronic central pelvic pain and painful bleeding during menstrual cycle, or abnormal bleeding is occurring, or what happens is that painful urination, painful defecation, pain during sex, they are all the symptoms of endometriosis, right? What are the outcomes of it? Outcomes, as we have studied before: inflammation is caused, irritation is caused, which leads to pain. Adhesions are formed, which might block the tube or lead to due to pressure on the other pelvic organs, and therefore lead to infertility as well. And chocolate cyst, it also leads to infertility. The number or extent of endometriosis does not define your pain. It can happen that a person can have small number of cysts, small number of endometriosis, or extent of endometriosis is limited, but they can have bad pelvic pain. Or sometimes a person can be asymptomatic, nothing is there, but during surgery for the other reasons they discover that they have present adhesions or they have endometrial tissue. So basically, it might have symptoms, it might have no symptoms, right? As we have already discussed all the symptoms: the chronic pelvic pain, painful period, pain during sex, painful bowel movement, painful urination. The major symptom of endometriosis is infertility. Infertility के पीछे cause we have already discussed: adhesions हो सकती हैं, chocolate cyst हो सकती है, blockage of the endometrial tissue, endometrial lining हो सकती है. Anything can be the reason behind it. Now, what are the complications? Complications mein first thing is infertility. Second thing is, people say ovarian cancer, but the most prominent cancer which does not mostly occurs in it, but which does occur in it, is endometriosis associated adenocarcinoma. Okay, adenocarcinoma.